Welcome to Shore Perspectives, a community feature of WESR Radio, highlighting the spirit of the shore from those who call it home.
Hi, my name is Charmin Horton. I am the branch manager for the Foodbank of Southeastern Virginia and the Eastern Shore here at the Eastern Shore facility. A lot has happened since March. So for one, we know that individuals have lost their jobs or were unable to work due to all the local business closures. We know that schools were out, which we already know presents a huge issue for a lot of the families here on the Eastern Shore. So we know that the need was definitely going to grow. So we were able to pivot the way that we do our processes, the way we do food distribution, and try to target those specific areas of need. I would say that it has probably increased over 50% or more. On average, we were serving approximately about 5,000 individuals monthly. Many of those are duplicate numbers, individuals that come to us more than once. During the months from March to the end of June, we were distributing to more than 10,000 individuals. Our product donations definitely went down due to the high demand at our local grocery stores. We pick up what we consider food rescue from all 5 of the local grocery stores, Food Line and Walmart. And because their need was so great, it definitely put a hindrance on our donated product from those locations. However, the community, being what it is on the Eastern Shore, really stepped up. We couldn't have asked for more support from our local community. Being able to see us in the forefront and being able to see us be able to identify those higher needs areas and be able to be in those areas to distribute food really helped us considerably. We had food drives that just were fantastic, all the way from Northampton County, Cape Charles, all the way up the shore. We had some really great food drives, as well as wonderful, wonderful monetary support. We are still in need. We are in what we're calling the pandemic recovery. So what we're doing is we're looking towards how to identify those pockets of need still, knowing schools going back are what they are. It's definitely a different time for everybody. So trying to focus on those higher areas of need to be able to go into those areas and do further distributions. While our donations have picked up from our grocery stores as things have started to get back to normal. So that's been a tremendous help as well. Well, as you mentioned, during our previous conversations, here we are getting ready to move into the holiday season. The holiday season is extremely unknown. We are looking at developing further programs that focus on the holistic needs of the community that we're serving. So we're looking at, trying to end the line. Why are clients coming to us on a regular basis? We know that they are food insecure, but what other resources do they need? How can we help them build a better future for them and their families? So in doing that, obviously we're going to need more food drives. We're going to need monetary support, looking at the programs that we put in the community as we move forward. Community Partners of the Eastern Shore, as you know, is the Eastern Shore's only continuum of care. It is an organization made up of just about all the service providers on the Eastern Shore. It's CSB, it's Coalition Against Domestic Violence, it's the Housing Department, obviously the Food Bank, it is both of our health institutes, Rural Health as well as Riverside. It is social services, both counties, and it really is an organization of service providers that come together to try to envelop that holistic approach and try to ensure that the clients of the Eastern Shore or the families of the Eastern Shore have the access to the resources that they need, whether it's food insecurity, whether it is prevention services, whether it's mental health services, whether it's housing services, domestic violence services, medical services, health care. It really is the holistic approach to identifying the needs of those of the Eastern Shore and ensuring that they have access to those services.
Can you tell me a story or an account that you are familiar with of what it's like to have food insecurity?
Oh, that's a tough one, Kelley. I can go off of some of the conversations that I've had specifically during COVID. Mm-hmm. Individuals calling us here to find out how to access food, being in a situation that they've never had to be in before, knowing that they have lost their jobs at least temporarily, if not permanently. Their children are now at home. That's 2 meals a day that they were counting on in school, having to try to figure out childcare. Basically just trying to figure out how to live in the midst of this pandemic. That is, it was extremely difficult. It was extremely difficult for those individuals to call originally. It's extremely difficult to try to figure out what resources they need and how we can help them the most. I've referred people to all kinds of different resources over the last few months, and just trying to make sure that they have the resources that they need and that they can get the help that they need. Whether it's making sure that they have, applied for SNAP benefits, whether that's during the pandemic or outside of the pandemic. It's making sure that they know that there are other resources out there, making sure that they know that, yes, the schools are still doing food distribution and these are the dates and the times. Just trying to ensure that they know, amidst the chaos, exactly what was going on during the crisis. I've been here for 17 and a half years, and I have sat across from individuals just like you and I are sitting here that were afraid to go to a local distribution pantry because it's in the area where they live. We're afraid to let their neighbors know. I've had people come to me and say, hey, I know my neighbor doesn't have food. I can't get them to come out. I can't get them to seek help. What can I do to help them? I would have to just say, I know it's hard, and I'm not going to lie. Been there myself. I know it's difficult, but at some point you almost have to try to be like, okay, we're here to help, and that's really all we're here to do. We are not here to pass judgment. We are not here to make anybody feel shame for having to use our services, and we would encourage everybody who comes, through our line to do the same thing. Know that if you're in our line, you're in our line with a host of families just like you, and that all they're trying to do is put food on their tables. All they're trying to do, a lot of seniors don't want to come. They don't want them to have to admit that they need help. But a lot of the seniors that we talk to and that we do assist with, they're having to make a decision whether to put food on their table and eat to keep themselves healthy or purchase medication. Nobody should ever have to do that. You should never have to go home and wonder if you're going to be able to feed your children. You should never have to wonder if you're going to eat today or take your medication today. That just shouldn't happen, and we're here to make sure that doesn't happen. I would just like to encourage, folks to seek the help that they need, to know that we are here, that we are a community that supports a community. And without community support, we wouldn't be able to do what we do every day, but we also wouldn't be able to assist those that need our help as well. And know that your neighbors are just that. The Eastern Shore is a very neighborly community, and everybody's here really just to help everybody.
To donate, organize a food drive, or to receive assistance from the Foodbank of Southeastern Virginia and the Eastern Shore in Tasley, contact them at 757-787-2557. For WESR Radio and Shore Perspectives, I'm Kelley Gaskell.